Hello and welcome to another practice time with Amy.
And Jamie.
We are continuing our series on child therapy. And today our skill we're going to practice is limit setting. So setting limits and communicating those to, in this case, child clients. Jane, where does limit setting, boundaries, where does that exist in your therapeutic orbit?
Limit setting is incredibly important in family-based, especially because I am entering the family in their space. So there's a lot of things that might feel normal to the family when I'm not in session that just aren't appropriate in the context of the session. So it was a surprise, especially first starting family-based, just how many limits I needed to set that when you're, doing just telehealth or when you're in an office environment, like a more traditional, therapy office, you don't think about having to set those kinds of limits because they're just already like implicit in the space. So, this is very important in family-based work.
Yeah. And sounds hard in some ways, I imagine.
Can be very hard. And sometimes it's something you don't really think about until you're in the situation where there is, a potential risk or a potential danger, and you have to be able to calmly intervene in that moment.
Yeah, I'm curious to try out this skill today also, because it feels like there's a fine balance between setting limits, which are important, and doing them therapeutically.
Yeah, absolutely. Let's now take a look at the criteria. Amy, you want to read that?
Sure. So there are 3 criteria for this skill. 1, directly acknowledge the child's feelings, wants, and or needs without judgment. Number 2, communicate the limit with a firm but supportive tone. If there's not an overt safety risk, the limit can be implicit. And 3, offer a safe and acceptable alternative. So again, 1, acknowledging the feelings the child is having. 2, communicate the limit firmly and supportively. And then 3, offer a safe alternative. So, Jamie, you'll be the therapist today.
Yeah, sounds great.
I will embody my inner child client. Do you feel ready to try out some practice?
Yeah. Are you feeling dangerous? Feeling like getting into some risky business?
Let's see. I'm going to yell as loud as I can this whole session. That way everyone in this place will know what I'm thinking and feeling.
Okay, it sounds like you're feeling really frustrated and really wanting to make sure that we hear you. It is important that in this space that we don't that we speak at a calm, quiet voice. But if you're feeling frustrated, we can get one of the squishy toys for you to squeeze really hard.
Nice. Well done. Rolling with my, you didn't laugh, which is impressive.
You're really committed. I felt the
so checking criteria, you definitely met criteria 1 by acknowledging my feelings of frustration and really wanting to be heard. I really liked that part. Number 2, you met communicating the limit of, here we have to be quiet or, quieter. And then you met criteria 3 by offering an alternative that I could use the squishy toy. So I think that was great.
Awesome. Yeah, that felt pretty good. And I really like the way that these criteria are set up. It feels it feels very natural. So like, even though this skill is technically a more advanced skill, this criteria has like a really nice flow. So that felt not too bad.
Do you want to try it again or try a different one?
I would like to try a different one. I'd like to move on.
All right. I want to go show this to my mom. I'll be right back.
So it sounds like you're really excited to show this thing to your mom. It's important that we stay together during this time. But I think it would be great for you to show your mom after the session.
Nice. How did that feel?
I felt pretty good. Felt pretty like organic, pretty fluid.
Nice. I agree. I think looking at criteria, again, you met criteria 1 by acknowledging my feelings of, I'm excited to show my mom. Criteria 2, you communicated the limit that, I need to stay in session when session's happening. And then 3, offered an alternative for me to show my mom after session. So I think you met all criteria again.
Sweet. Can we check out the example response for this one?
Sure. So the statement is, I want to go show this to my mom. I'll be right back.
And the example response is, it's so hard to stay in the room today. You're really wanting to see your mom and check in with her. Instead of going to show her that, can we sit down together for a moment? It would be good for me to understand a bit more about what you're feeling when you get the urge to leave. Can you tell me about it?
Nice. Your response super tracked that. They took it a little further to like explore more, but great job. It like tracked almost exactly.
Awesome. Right. I am ready to take it one step further.
All right. I'm going to throw it at you.
Okay.
Give you the content for this. It's a 16-year-old client being flirtatious is the cue. Damn, you're actually pretty hot.
Oh, you got me. You got me. All right.
Should I say it again?
Yeah, we'll do that.
All right. Damn, you're actually pretty hot.
Okay, so you giving me that feedback. I think it sounds like that was intended to be a compliment, and those kinds of compliments make those kinds of compliments towards me are not appropriate. Is there a way that we could phrase that compliment that in a way that might be a little bit more appropriate?
Okay, you got it. I was really helping you get through it. So let's check the skill criteria.
Yeah.
I think with criteria 1, I think you could try more to acknowledge what they're feeling underneath this compliment, right? You named it as like trying to be a compliment, but I think you could try to deepen like what is underneath this for them. Criteria 2, you did communicate the limit, right? That this is not appropriate in this setting. And then criteria 3, I think you did try to offer an alternative. I think you could try to find a different one that maybe redirected or I think it would work on criteria 3.
Yeah, for sure. Okay, yeah, I have to think about what looking at criteria 1, what the want or need would be based on that.
Mhm. Mhm. Yeah, it's hard because it's a little shocking.
Mhm.
Mhm.
Yeah. What would you say
Well, I can't
as
tell
the
you.
client?
Can't tell you. That would not be your practice.
Okay. All right. All right.
Let's try it again, and then I'll tell you my thoughts.
Okay.
Damn, you're actually pretty hot.
Okay. You sharing that with me makes me think that maybe you would want or need, would want some sort of attention from me. um, and, those kinds of statements towards me are not appropriate. But there are other ways in which you can get my attention. And we can absolutely talk about that.
Nice.
Woo!
Did it.
All right, I got there.
So I think that was much better. Looking at the criteria, you did a much better job at acknowledging the feelings underneath, right? Maybe there's a need around like attention. You, again, met criteria 2 by communicating that limit. It's not appropriate in this space. And then I really liked what you did with criteria 3 to offer an alternative of there are other ways you can get my attention. Do you want to check out the example response for that?
Yes, definitely.
So the statement says, damn, you're actually pretty hot.
Okay. And one of the example responses provided says, I'm not quite sure how to respond to that. Totally valid. I'm wondering if you are expecting me to react with shock, discomfort, or to somehow reciprocate. You talk about a lot of intimate things with me, but it's important for me to say that our relationship is a professional therapeutic one. Instead of commenting on my appearance, can you tell me more about the feelings you're having?
Right.
So this was really helpful, especially the first sentence of just being able to be super transparent with the client and be like, wow, wasn't expecting that. Caught me off guard there, threw me for a loop.
Yeah. How was that for you? It seemed like a couple of the statements were super hard.
Yeah, I was like over here on like a totally unwarranted ego trip from the first two, like, oh, wow, these are so easy. And then it was like, let me just put my foot into my mouth because those next two were much more challenging. So that was a very humbling experience.
Yeah, and it seemed like the ones that were involving you as the therapist really caught you off guard, which makes sense because it's hard to set the limit, but also explore what's underneath it and offer an alternative, right? That you couldn't just say like, no, don't flirt with me, but explore like, okay, well, what's underneath that flirtation and don't flirt with me.
Yeah, because those two, that's a totally helpful distinction that you just made for me, because it takes it, it makes it more about my relationship with the client when it is something that involves me more directly in that way. So it is like this extra layer and this extra consideration that made it significantly harder for me to navigate.
Yeah. I also appreciated about the example responses of this skill that there was genuine reaction, right? That like in the context of setting limits with clients, like they're going to throw something at you that you're going to be like, I need a minute to figure out my reaction. And I liked that they modeled that, like, I'm not exactly sure how to respond here.
Totally.
Like, good job. It was not easy.
We were wrapping up our child therapy exercises with a doozy.
Mhm. So, Jamie, I hear you wanting to connect and really talk with me today, but I'm going to have to set a limit on our time now, and offer that, next practice time we can continue this conversation.
Oh, that was flawless.
That
Yeah.
was pretty good, actually. I met all three criteria there.
Perfect. Well, thanks for checking out another practice time with Jamie.
And Amy.
And we will see you next time with
Systemic family therapy. Yep. All right.